Today, what the largest study to date found about antidepressants in pregnancy and the risk of autism or ADHD. A patient who's pregnant asks whether her antidepressant might cause autism or ADHD in her baby. It's one of the most anxiety-provoking questions in psychiatric practice, and new evidence just shifted the ground beneath it. The largest meta-analysis on this question analyzed 37 studies covering more than 648,000 antidepressant-exposed pregnancies and nearly 25 million unexposed ones. Before adjusting for confounders, there was a small increased risk for autism, relative risk of 1.69, and for ADHD, relative risk of 1.35. But those numbers almost entirely disappeared once researchers accounted for maternal mental health disorders, genetic predisposition, and other confounding factors. The most convincing evidence against causation: children whose fathers took antidepressants during pregnancy showed the same elevated risk. And so did children whose mothers took the same drugs before, but not during pregnancy. If the medication were causing autism or ADHD, those patterns would not exist. The takeaway for clinical practice: SSRIs should not be discontinued during pregnancy out of concern for neurodevelopmental risk. The protective value of treating maternal depression for both mother and child is well established. Only amitriptyline and nortriptyline, older tricyclics typically used for more severe or treatment-resistant depression, showed some residual signal in the adjusted analyses. But even that may reflect the severity of the underlying condition rather than the drug. The largest study to date delivers the clearest answer we have had. Antidepressants in pregnancy do not meaningfully cause autism or ADHD. The observed associations are better explained by genetic predisposition and the burden of maternal mental illness itself. The conversation with your pregnant patient should reflect this and focus on the real risks of untreated depression, not the largely discredited risks of her medication. Questions about today's content or topics you'd like to see covered in future episodes? Drop them in the comments below. And if you found this clinically useful, hit subscribe. More psychopharmacology breakdowns are coming. This video is for educational purposes only and is not a substitute for clinical judgment.